All right, so welcome everybody. My name is Toni Morgan. For those who don't know, I'm the Managing Director for the Center for Law, Innovation, and Creativity at the Northeastern University School of Law in Boston, Massachusetts. CLIC for short is a research and practice center focused on intellectual property and technology law with a particular interest on privacy. So that is, we are hosting this event because this definitely falls within the purview of the work that we are very much interested in. But what makes CLIC distinct is that we are housed within a law school that is focused on public interest and social justice. And so our faculty, in addition to acknowledging the innovations that come with technological development and tech progress, also raise questions about the implications of this technology on society, on our environment, on humanity, on social relations, on human life as we know it. So this leads to specifically why we're talking about the issue that we're talking about today. This event is part of a three-part summer series hosted by CLIC called Scrutinizing Surveillance. And really what we're looking at is the proliferation of tools that gather data about us, our preferences, our movements, our behaviors through the deployment of technology. And of course, what impact that has on us today. So today's topic explores the intersection of health and technology, and we are delighted to partner with our colleagues at the Center for Health Law and Policy, one of the country's premier programs for health law, to produce this event. I am going to turn it over to my colleague, Jennifer Hewer, the Managing Director for the Center for Health Policy and Law, and she's going to share a little bit about the center and what they do.
Hello, everyone. Welcome. I'm so excited to be here, and thank you to Toni and the other CLIC faculty and staff for inviting us to join. Really excited to have this conversation. So the Center for Health Policy and Law is what we think of as a hub around the university and then certainly within the law school for all things health related. We work on myriad issues like access to medicine and drug policy, immigrant health, population health and health equities, among many other topics, which I'm sure many of you are familiar with. As I look at a lot of the screens, I'm so excited to see many of students that we consider to be some of our health law students. So it's wonderful to see you all. We work with faculty and staff and students across the university, as I mentioned. We have a lot of different partnerships, including the Public Health Advocacy Institute, the Institute for Health Equity and Social Justice Research, and then many other collaborators across the Boston community and across the US. For those of you who are interested in learning a little bit more about some of the public health issues that we work on, I invite you to visit publichealthlawwatch.org. It's a really cool blog and website that we host, and we post updates and also ways for individuals to be involved in some of the activities and happenings around the US in terms of healthcare and public health updates. You can also follow us on Twitter at Newsel Health to find out more and to engage with us in conversations about any topics that you might be interested in.
Thank you, Jennifer. Speaking of social chatter, if you are online and want to engage with us about this conversation, you can use the hashtag Scrutinizing Surveillance. It's a long hashtag, but you'll find us and we'll stay connected and we'll certainly respond to you. And so we look forward to engaging with you online. So the novel coronavirus, COVID-19, has upended life as we know it. Its devastating effects, 116 confirmed cases in Massachusetts, but over 400,000 cases in Texas and Florida and growing, have created this unprecedented pace of mass cooperation as folks try to figure out how to contain and understand and find a cure to this virus. So we know that scientists, policymakers, decision makers, doctors, innovators are working really hard to figure out how to prevent the increased the increased pace of infection. In April, during what I would call, I think what many of us would call kind of phase one of this, of the coronavirus pandemic, we saw two companies in particular, two tech companies, propose a solution. That solution in tracking and tracing and understanding how to contain the virus. And that was contact tracing, proposed by Apple and Google. So that was in April. By June, many of us, those of us who have smartphones, recognized that there was a slight slowdown in the network, and coincidentally in that time, contact tracing apps were added to our phones. And so at the beginning, governments were very enthusiastic and supportive of the prospect of what contact tracing promised. The solution promised this idea that we could track and trace who is affected, who is at risk, who is at high risk, and what that means. But that's also raised some additional questions around our privacy. It's raised questions about public health. It's raised questions about what the future of work and social and movement look like as we know it. And so this conversation is really designed to ask questions and to understand better what the implications of a solution like contact tracing proposes in a moment of a public health global pandemic that affects us all, but in particular has a disparate impact on particular communities of color, low-income communities, working class communities, immigrant communities, and so on. And so today's conversation raises questions about what does this mean for our health? What does this mean for the future of technology? What does this mean for the future of privacy as we know it? And so I am pleased to be joined by our panelists, our three panelists, experts in their respective fields. I'm going to introduce them with a bio of their work and accomplishments. And as I do that, I would encourage you to, one, take note of the speakers and their affiliations, and be prepared, if necessary, to ask questions of some of the remarks and some of the questions that come up as a result of this discussion here. So I'm going to start with Gregory Nojeim, Director of the Project on Freedom, Security, and Technology at the Center for Democracy and Technology, CDT for short, a Washington, D.C. NGO dedicated to internet freedom. Greg specializes in protecting privacy in the digital age against intrusion by the government. He is a recognized expert on cross-border law enforcement demands, the USA Patriot Act, FISA, the application of the Fourth Amendment to the US Constitution to electronic surveillance. And he is part of the CDT team that is working to ensure that efforts to provide law enforcement access to communications content do not undermine communication security. He leads CDT's cybersecurity policy work, testifying in the US Congress on the impact of cybersecurity proposals on privacy. Greg leads up the CDT Coronavirus Data for Life and Liberty Task Force, which brings together representatives of NGOs, of tech and telecom companies, academics, lawyers, and medical professionals to discuss how technology and data can be used to fight COVID-19 without compromising privacy and civil liberties. Greg sits on the board of directors of the Global Network Initiative, a multi-stakeholder organization dedicated to promoting privacy and free expression online. And prior to CDT in 2007, Greg was the associate director of the American Civil Liberties Union. I was going to jump to ACLU, Washington Legislative Office. So welcome, Greg. Thank you so much for being here. Our next panelist is Wendy Parmet, Matthews Distinguished Professor of Law and Director of the Center for Health Policy and Law, our event co-host here, and Professor of Public Policy and Urban Affairs. Professor Parmet is a leading expert on health law, on health, disability, and public health law, and directs the school's Center for Health Policy and Law. She holds a joint appointment with Northeastern University School of Public Policy and Urban Affairs in recognition of her national leadership in interdisciplinary thinking and problem solving on issues related to healthcare. In addition, she is the co-editor of the law school's SSRN online publications, Human Rights and the Global Economy, and the Northeastern University School of Law, Public Law and Legal Theory paper series. In 2016, Professor Parmet was honored with the prestigious J. Healy Health Law Teachers Award by the American Society of Law, Medicine, and Ethics at its annual conference. Professor Parmet has published articles on public health, bioethics, discrimination, health law, and AIDS law. She is co-author of Health of Newcomers, Immigration, Health Policy, and the Case for Global Solidarity, and Ethical Healthcare. She is also the co-editor of Debates on U.S. Healthcare and the author of Populations, Public Health, and the Law. In 1998, Professor Parmet acted as co-counsel in Bragdon v. Abbott, the first AIDS HIV case to come before the US Supreme Court under the Americans with Disabilities Act. Professor Parmet's client, Sydney Abbott, had been refused treatment by her dentist when she revealed her HIV positive status, although she was asymptomatic. The High Court said that because she was infected with HIV, she was entitled to the protections of the Americans with Disabilities Act. In 2012, Professor Parmet was lead counsel in Finch v. Commonwealth Health Insurance Connector Authority. Let me say that again. Finch v. Commonwealth Health Insurance Connector Authority, in which Massachusetts Supreme Judicial Court found that the state law denying state-subsidized health insurance to legal immigrants was unconstitutional. Welcome, Professor Parmet. And finally, we have CLIC faculty member, Professor Woody Hartzog, for those who follow him online, Professor of Law and Computer Science. Professor Hartzog joined the faculty of law at the Northeastern University School of Law in 2017 and holds a joint appointment with the Corey College of Computer Sciences, where he teaches privacy and data protection issues. His research focuses on law and policy issues related to privacy, digital technologies, and artificial intelligence. Professor Hartzog's work has been published in numerous scholarly publications, such as Yale Law Journal, Columbia Law Review, California Law Review, and Michigan Law Review, and popular national publications such as the New York Times, the Washington Post, the Guardian, the Atlantic, the Nation, and many more. He has testified 3 times before Congress on privacy and data protection issues, and his book, Privacy's Blueprint: The Battle to Control the Design of New Technologies, has been called one of the most important books about privacy in our times. Prior to joining the Northeastern faculty, Professor Hartzog was the Starnes Professor of Law at Stanford University's Cumberland School of Law. He has served as a visiting professor at Notre Dame Law School and University of Maine Law School. Professor Hartzog previously worked as an attorney in private practice as a trademark attorney for the US Patent and Trademark Office, as well as served as the clerk for the Electronic Privacy Information Center, EPIC for short. He holds a PhD in mass communications from University of North Carolina at Chapel Hill, an LLM in intellectual property from George Washington University Law School, and a JD from Stanford University. Welcome, Professor Hartzog. So as you have heard, we have an illustrious panel, and we are going to open up with some remarks from our panelists who are going to help set the context for this discussion today. Again, I want to remind everybody that you are welcome to share your questions in the chat, and we will add them to the queue. I also want to make note that Professor Parmet has to leave early at 1 p.m. So if you have questions that are specifically directed to Professor Parmet, please let us know, and we are going to do our best to make sure that we ask them before she has to leave. Thank you everyone for being here, and we are going to start with Greg.
Thanks so much, Tony. I assume folks can hear me, yes?
We can hear
Okay. First, apologies for having such a long bio. I'll never do it again. Thank you everybody for sticking with us. If we were all in the same room, I would be asking everyone to move up to the front seat so we could all see each other and interact better. We're not in the same room, but I am going to ask, if you feel comfortable, turn your camera on. I want to know if I'm saying something that makes you angry or proud or brings a smile to your face or a frown. So feel free to turn your camera on. And remember, if your camera goes on, you're more likely to be seen by the other people in the room than for those people whose cameras are off. Anyway, welcome to the event. Again, I'm Greg Nojeim with the Center for Democracy and Technology. We're based in Washington, D.C. We have an office in Brussels, and we've been working on the privacy and equality issues that come out of the contact tracing apps that are being developed for fighting COVID-19. As Tony mentioned, we have convened a task force that is looking at the privacy, equality, and other questions that come up from the use of technology to respond to the COVID-19 pandemic. When I think about the contact tracing apps in particular, we start our inquiry with effectiveness. Are they going to be effective in fighting COVID-19? And is their effectiveness being affirmed by the health professionals who have to integrate the results of the contact tracing apps into their contact tracing efforts. So for example, if health professionals in one jurisdiction are not going to use the results of these apps, and remember, they'll be getting notices from individuals who say, hey, the app says I was exposed, or I am giving you notice that I was exposed to someone who had COVID-19. How is that going to fit within their contact tracing efforts? And so that relates to the effectiveness of the apps. And also, are the apps going to be effective in that they give the right people notice, or are they giving notice to people who probably weren't exposed? And I think these are still open questions. And let me just divert for 1 minute on the technology behind these apps. They rely on Bluetooth signals. Bluetooth signals pass through walls. If there's a wall between me and the infected person, I don't want to get a notice that I may have been exposed. So these things have to be worked through. And I think there's not enough data to say that they have been worked through sufficiently. There are also questions about privacy. And I think with respect to the contact tracing apps, those questions go to whether a person who is considering the use of the app is able to use it voluntarily or not. Is the decision to download voluntary? Is the decision to give notice voluntary or automatic? There are also questions about the model being used for the contact tracing app. Is it one based on centrality or non-centrality? If the results of notification go automatically to the health authority, it is probably a centralized model, whereas the Google Apple API accommodates only dispersed models, meaning that the data resides on your phone and not with the health authorities. So that gives you additional control. Also, with respect to privacy, there are questions about whether the app can rely on location information. Location information is particularly sensitive in that it can be used to infer one's activities. The Supreme Court recently ruled in another context that location information stored over time is so sensitive that a warrant must be obtained in order to access it. So does the app rely on location or just proximity? Proximity is, was I near an infected person or not? Location is, where was I when I was near that person? And the Google Apple API relies on proximity and doesn't allow the use of location. Another big issue is equality, and Tony, you touched on it at the outset. We know now that COVID-19 is hitting some communities harder than it hits others. African Americans, Latinos, Native Americans, elderly Americans, essential workers, people who work in grocery stores, people who work in doctors' offices, people who work in hospitals, incarcerated people. They are all being subjected to COVID-19 infections and COVID-19 mortality at a disproportionate rate. We want to make sure that if we go down the contact tracing app route, that we are accommodating the needs of these communities and not exacerbating existing inequalities. For example, if the use of contact tracing apps results in a diversion of contact tracing resources from helping these communities deal with the possibility of infection or with actual infection, we've probably not accomplished a good thing. We've diverted resources from the problem instead of helping to address the problem. And finally, one thing that I think has been under discussed and needs to have more centrality to this debate is the potential for downstream uses by actors other than governmental entities. If my employer says, hey, Greg, we only want safe workers in the workplace, and the safe workers are not just the ones who wear masks, but the ones who download these apps and who agree to give notice when they've been exposed or diagnosed, that becomes no longer voluntary for me. I have to use the app. If the operator of the stadium, when it opens, says you've got to have the app in order to see the baseball game, it might not be voluntary for some folks, still voluntary for me, but for some folks, it might not be considered voluntary, especially the season ticket holders. So I think we've got to start thinking about these downstream uses and potential requirements, and need to do it soon and have in place a regulatory or legal regime that that people are comfortable with before we start down the road of using these apps. I'll stop there and I look forward to the discussion. Thanks, Tony.
Thank you, Greg. A lot of food for thought there. I thought it was important because we talk about contact tracing and it's become a bit of a buzzword. I thought it would be really important for this discussion to start this conversation by just giving folks some context about what contact tracing actually is and some of the harms. And so thank you for doing that, Greg. We're gonna move on to Professor Parmet.
Thank you so much. Before I begin, a couple of apologies. First, as Tony said, I have to leave at 1, so I apologize for that. Secondly, I apologize. I am the technologically impaired member of this panel. So I come to this as a person who has been working in the area of public health law for a long time. And so I come to it somewhat from a different perspective. And I mean my remarks, I should apologize again for this too, to be somewhat provocative. I'm saying some things I might not have thought I ever would say. So bear with me. Let me start with what may seem to be a paradox. The worse the pandemic has become in the United States, and it is bad, the less the threat to our privacy. Our privacy has not been threatened to date as much as we might have feared, precisely because we have failed so miserably to control the pandemic. The primary response to date has been community-wide measures, business closings, stay-at-home measures, closing the bars, mask mandates. Many of these measures, such as school closings, are relatively self-enforcing. Others, such as mask mandates, and obviously there's been great variation among the states. Compliance has been too spotty, and public authorities have not really tried to enforce compliance. They have relied primarily on persuasion and hopefully norm changing. For this reason, contact tracing apps have played a far smaller role, and the threat to privacy has been less significant than it has been with many other pandemics and epidemics of the past. Nevertheless, as Greg suggests, there are certainly critical questions for privacy and equity that would come to play should we be able to get enough hold of the pandemic to ever actually utilize these technologies or contact tracing in a robust way. But the devastation that has been wrought by COVID-19 and our overly broad, definitely second best community-wide mitigation measures raises for me the question that I did not think I might have asked once upon a time. Is it possible that vulnerable communities would be better off with an approach that violated their privacy more and that was more targeted? And even, in other words, despite the dangers to privacy and the dangers to vulnerable communities, might these same communities might be better off with an approach that could allow us to move more away from these community-wide measures. Now, to be sure, throughout history, long before the development of any high-tech surveillance methods, isolation, quarantine, surveillance, and contact tracing have been used disparately and invidiously against stigmatized groups. This has been very common. But the pandemic itself is affecting these groups so disparately and so dramatically. And the community-wide measures are affecting these groups so disparately and so dramatically that we may have come to a place that we could only wish we could get to a point where we could use these other measures. Again, I want to be clear. There is a risk for the misuse of data, particularly as Greg suggested, data and misuse that data will be used down the line by employers, by other groups in ways that we might be worried about. And there is the risk that these apps or contact tracing without apps and quarantine that can follow from it will be used disparately against communities of color and other vulnerable groups. That has been the history of these measures long before there was technology. But the virus itself and the community mitigation measures, the business closings, et cetera, have really hurt vulnerable communities so significantly that I think we might only wish for the day that we can get, in a sense, have the luxury of worrying about the privacy issues. Let me conclude by saying that, surveillance for public health has a very long tradition. Governments have required, states in particular, have required reporting about reportable diseases, mandatory reporting from everything from child abuse to measles cases. This is a very long tradition. To some extent, we've never had the freedom to keep communicable diseases private. The question isn't really, can we keep them private, to me, just like the question isn't, do I have the freedom or privacy to not wear a mask when I go out in public? We are dealing with a public health crisis. This is a public harm. This is not about individual behaviors and my choice to do certain things, or at least I don't think it should be, because individual privacy, individual autonomy is hurting other people right now. The question is, how do we safeguard, how do we put in place and make sure that we can reduce as much possible the negative impact of contact tracing and surveillance? And that's an important conversation. But once again, we should be lucky if we get to the day when that conversation is actually required, because right now the problem is too big to even get there. So let me stop there, and I look forward to the conversation.
Thank you, Wendy. So that is a perfect, I feel like, segue into introducing Woody in terms of discussing the privacy implications and the concerns around privacy with contact tracing. So without any further ado, I'm going to turn this over to Professor Hartzog.
Thank you so much, Tony. Everyone can hear me, I presume it's okay? Okay. So thank you, Jennifer. Thank you, Wendy. Thank you, Greg. Thank you for these comments coming up. It may be expected that I would disagree with Wendy about some of the privacy things, but I actually totally agree with her on almost all counts. And so I want to just make just maybe 3 or 4 simple statements, because I know we're supposed to keep this short. One is that I completely believe that public health surveillance can be done effectively in a way that is consistent with privacy interests. But in order for us to do that, we're going to have to start conceiving of privacy as something more than just something that is violated once information is collected. There are ways of thinking about privacy that we might protect people's privacy through thinking about it as something that's a matter of trust. Something that if I give it to you, then you have certain obligations to do with it. Something, by the way, that health professionals are quite good at and quite trained at, and in fact have a long history of. And so So to that end, as a subpoint of that, there are two things that Greg brought up that I actually don't think are the third rail for preserving privacy in these contact tracing apps, which as Greg, I think, very wisely pointed out, are often actually proximity notification apps, not necessarily contact tracing apps. And I don't think that the decentralized model is the cosmos for privacy protection. The idea that you would collect information in a decentralized way such that it limits the abuse is certainly attractive and one of the fundamental principles of data protection law. But I think that there are ways of doing a centralized model that are still aligned with privacy interests, presuming a lot of other things, which I'll get to. The other thing that I don't think is a third rail is whether it's voluntary or not. And I agree with Wendy on this, in that that you can also conceive of something that's mandatory either in law or, as Greg, I think, wisely noted, de facto, because your employer requires it or you require it to gain entrance into a building. In the same way that we would say wearing a mask is voluntary. And again, if we think of privacy as something different than just you violated my privacy by merely collecting the information, then maybe we can get to public health surveillance. Now, what that leads us to, though, is that it puts the weight on different parts of our analysis, right? So instead of saying what's collected, we then have to sort of back up and say, well, where does the data then fit into this larger system? And what we then have to know about that is that we're implementing systems that are going to linger for a long time and that are malleable to change and being co-opted by other forces that want to take advantage of them, right? So we have to really watch out for that. And so that leads us to a couple of different problems that I'm happy to talk about. But the things that I really worry about in this debate are, one, the tendency to try to solve incredibly complex social problems with shiny new gadgets, right? So a lot of the contact tracing debate to me feels like a lot is being asked of the shiny new toy from something that's a crumbling infrastructure that we've sort of let decline for a long time, and it's just not up to it. And so I worry that we're going to be putting too much faith, at least that was my worry at the beginning. Now that the debate has changed a little bit, that we would put too much faith in the apps, right? That the app's going to save us, and it's not. Even if it works well, it's not single-handedly. You can't replace, from what I understand about full contact tracing, it can't replace the work that goes into a full accounting of contact tracing. And then the other thing that I really worry about, and this has been touched on by both Greg and Wendy, is that the apps are only a very small piece of leveraging technology and personal information to respond to COVID-19. And we are not going to solve this. The apps are going to be relatively ineffective unless we solve some of the larger problems that people have about trusting these entities. The reason that Greg and many people are wanting this to be voluntary is because we have let the personal data ecosystem and platforms turn into such a massive dumpster fire that, of course, we are terrified of sharing our information with them. And so there's a larger problem here. We worry about mission creep, not just with creeping from health authorities to government, but from health authorities to other platforms. We worry about the massive amount of disinformation that is being propagated on social media that is counteracting the best efforts of public health authorities. We worry about the equality issues. I think that's been very rightly articulated, that this falls on people of color and other marginalized communities in ways that it does not more broadly. And we have to take account for that. And if we don't take account of all of that, then all of these sort of more nuanced conversations about what does the app collect, what does it do, how, what's its false positive rate, what's its false negative rate, we're just spitting into the wind.
Thank you. Thank you, Woody. So, wow, three incredible positions in terms of understanding not only the implications of contact tracing, but the question we put out there was, is the implementation of this technology really worth it? what are some of the risks that are associated with that? And so we're gonna ask our panelists a few questions, and Jennifer is going to ask these. But before we do that, because Wendy Professor Parmet is leaving a bit early, the next section, the section following the moderated questions, includes an opportunity for panelists to ask each other a question or to pose a question to the audience. And we're actually going to take this time for Professor Parmet to use her time to respond or speak to Professor Hartzog before she has to take off.
Thank you so much. I just wanted to say, I guess I don't have a question right now, but I really want to underscore something that what he said. Contact tracing is a tool, whether it's done through old-fashioned, people walking, telephone calls, or whether it's done through an app. But in order to be effective, whatever the technology, right, what we need is so many things we do not have right now in this country. For example, you call someone, you contact trace, you tell someone they've been exposed. What are they supposed to do right now? Many countries are finding hotel rooms and places where people who have been exposed, who don't live alone, can stay until we know whether or not they're infectious, so that they don't, in fact, transmit the infection to their family and other housemates. We don't have that widespread in this country. What if the person who's told that they're a contact is the only caregiver for elderly parents? What's supposed to happen to those elderly parents? Who knows? What happens if they're an essential worker or they're the only source of, money for their family? What's supposed to happen? Who knows? And we could go on and on and on. Contact tracing is a tool, whether we're doing it through the telephone, the fax machine, or the Pony Express. At the end of the day, what we need in this country is a plethora of further supports to help people get through this and do the right thing and not expose others. And without that, the technology is, as what he said, a shiny new thing.
Thank you, Professor Parmet. So I want to turn over to Jennifer Hewer, who has a few questions to ask. And I imagine that many of us have questions and thoughts based on the remarks shared. So again, I would encourage you, feel free to share your questions with us. You can send them either to me privately in the chat, or you can follow us online with the hashtag scrutinizing surveillance, and we will compile your questions.
Thanks, Tony. And thank you to all of the panelists. I know that we had prepared some questions ahead of time, but I took multiple pages of notes while you were all speaking. And so I hope you don't mind that I ask a couple of questions based on some of what you said, mainly for my own interest, but I think it'll interest everybody in the room. So I love that you all touched on this idea of involuntariness and what are some of the moments in time when it becomes less voluntary and more mandatory. And I want to kind of talk about what are some of the appropriate responses that communities can have, but also thinking from a legal and policy perspective. So for example, I was recently talking with a friend and she said that her workplace is going to require them to track through an app. And that they have been told, if you don't do this, you might as well not come into work. And so then her response was, okay, so then do I just get to work remotely? Are my benefits going to be cut? Like, what is your response? Because to me, it sounds like it's now mandatory. And so I need to know, how is that going to affect my employment? Because there are, I don't necessarily trust. We've gone through this, for those of you who are familiar with employment-based wellness programs, issues similar have come up in the workplace about, what is my employer going to do with this information? Is this going to affect my pay or even the percentage that I have to contribute toward my healthcare benefits? Is there going to be a different attitude in the workplace about my performance and my ability to work? And so, that was just one example. And I thought it was interesting too, that you also brought up the idea of Greg, I believe you brought up the idea of even access to venues that we would normally think of as entertainment venues, right? Whether it's the ballpark or wherever. The mall, I heard somebody recently say that there's a shopping center who's going to, think about asking people to do something similar. So would love to hear thoughts from our speakers on, what are some of the appropriate things that we could be doing ahead of time, thinking about a moment when, as we go back to the workplace, as we go back to schools, as we go back to a semi-normal life, I don't even know what that means. What are some of the things that we can build in to protect people? If there's anything at all.
May I start with that? May I start the responses? So I think about the different contexts in which we will be concerned about our safety. And those are the contexts in which there will be pressure to require people to mask or download the app or do both, right? So for example, there's the employment situation. You're next to your coworkers often for a long time, and you're close to them. There's restaurants. You're next to other guests in the restaurant for the duration of the meal, and nobody's masking when they're eating. The mall, as you mentioned, sports and entertainment venues. What about schools, universities? Would students at Northeastern be expected to download the app and, in a sense, help each other fight the disease, because there would be more efficient notice of potential exposure? Those are the things I think about. And then I think about something else. When we talk about privacy in the contact tracing world, we need to think not just about what does privacy with respect to the app mean, but what does privacy look like in the manual contact tracing world as well? Because you're asked some pretty intrusive questions. Who were you near? How long? Who were you near for the last 14 days? You can't answer some of those questions. You can answer some of them, right? You were near so-and-so when you did such and such, but you don't know who you were near at Starbucks. These people are unknown to you. So I think we have to keep in mind that there are intrusive questions that are answered in the manual world, and kind of weigh that against the intrusiveness of the data collection in the app world as well. And by the way, it also seems to me that if you get an exposure notice, first thing I'm going to do is call the health authorities and say, what do I do now? And then they're going to ask me all those questions anyway. So maybe we're in that world of maximum exposure, if you will, of our private comings and goings, no matter what we do.
Yeah, that's really great. That gets back to the trust issue that Woody and Wendy mentioned as well, about in thinking particularly about vulnerable communities and communities that have historically had that lack of trust in those who ask some of these questions and collects some of this data. And we can touch on that in a moment, but I just want to give Woody and Wendy an opportunity to answer that first question if they'd like. Go ahead, Woody.
Yeah, so there's several points. I think it's it's hard because, of course, you're weighing a lot of different values all at the same time, and you're doing a lot of different risk modeling all at the same time. The first thing I think about is, of course, is when we're talking about surveillance and contact tracing and COVID, it's equity issues all the way down. And so if you're going to mandate that someone have an app, then do they have a phone? Right? Not everybody has one. And a lot of people don't carry them on them all the time. And so I think you have to be really sensitive to a lot of those issues, even out of the gate. But the two most other important things that I think you really have to watch out for are the inevitable creep that comes because there's a surveillance inertia is a hell of a thing. And one of the things that I think would actually build people's confidence in the system is if we had a better set of either rules and legal frameworks, or in the very least, affirmative legally binding promises from companies and entities that ensured that the data that was collected would not be repurposed for all sorts of other things, which it currently is now, and that it will have a set time to end. Because one of the things that's scary about the sort of general precariousness of our public health situations, it's not clear when it's going to end. And it reminds me a little bit of the war on drugs, which we have been, fighting since it started, right, with no end in sight, or the surveillance authorities that were granted in the wake of the September 11th attacks that we're still re-upping to this day. And so I think that it would actually fortify a system to try and articulate clear endpoints. In other words, one of the ways that we can improve this is make this very different from everything we've done with privacy and data protection up to this point. And there's a chance to do that.
Easy, super easy.
Easy.
When you just talked about that, it to me, it raises the question of the end to the data collection, but also, especially now that we're cloud-based, I'm still trying to figure out what that means, but app-based, when does the data itself end, right? Like, how do we destroy data? I know that that's a question that frequently comes up a lot, and is it even possible to destroy data? Or is it always going to be somehow accessible, penetrable by somebody who may or may not have nefarious intent?
Right. Yeah, so data that doesn't exist can't be breached, and there are big questions about de-identification as well, which is something that we do with a lot of health data now. And there's some good frameworks in HIPAA that talk about ways in which we might de-identify data to make it relatively safe to the people that are actually in the data set. Though we can have the specific debate over which de-identification methods are good and which ones aren't at a different time.
That's great. Wendy? Professor
I
Parmet.
just want to say, I agree with everything that's been said, but I just want to emphasize again that the whole reason we face that problem, employers requiring, stores requiring, is because of the complete erosion of our public health system and our conception of public health. We shouldn't be relying on the mall to protect our health. And the mall should not be doing contact. I mean, I'm not saying this in a privacy way, this is just a backwards way of doing this. This is right? If our government was doing what our government is supposed to do, one of its oldest, most primal functions, the mall wouldn't have to police the people who come in there, right? Same with, let me just talk about, like we mentioned the, analogy to wellness programs, which I think is very apt. Well, wellness programs are a function of privatized health insurance and the fact that employers are worried about their health insurance rates, right? And so instead of having public health deal with chronic diseases, we end up with employers, penalizing or incentivizing a little bit of both. This is sort of backwards. Pandemics, infectious outbreaks of this magnitude are not private problems, and we cannot privatize it. And we've been trying to privatize it. And there's a reason why, we're number one, the worst off in the world. It's because our whole conception of privatization and the erosion and thinning of the public space and government just doesn't work in a situation like this. Again, my calling for government doesn't mean we don't need careful, important curbs for its misuse. At the other end of the spectrum, we got to worry about Big Brother. But right now, we need functional government first.
Yeah, absolutely. I love that point about how we shift responsibility and what does that mean? And don't we give up a little bit of control? Like, isn't there an inherent comment about us trusting if we're allowing the system to move into different sectors? I think that's a really good point.
Briefly just add on to that, that's a perfect point to also say we've done this with our public health messaging system as well. And now Facebook and Twitter are sort of functioning as our de facto public messaging system because people don't know where else to go for answers, which is a problem because, you've been on those websites.
And if I can just add, and of course, these privatized systems lack the accountability that is at least theoretically, I admit it's theoretical sometimes there for our public mechanisms, right? There is no accountability. And if the mall doesn't want to let you in without the app, probably the mall can forbid you from coming in without the app. I mean, we should be having laws and public accountability, and instead we have private power because of our lack, again, of adequate public response or plan, or even a plan to have a response.
Oh, planning, wouldn't that be lovely? Greg, I noticed that you had a comment in the chat. Is that a comment / question that you wanted to offer to everybody, or is it just there for folks to read? I just want to make sure we don't miss anything.
It's just there for folks to read. If they want to address it, they can. If not, let's move on.
Okay.
Very quickly, we should read the question out loud because we have folks who are tuning in from the live stream, so they may not see what's in the chat.
Sounds good. So the question that Greg, why don't you read it? It might sound better in your voice.
If the employer requires employees to download an exposure notification app as a condition of working, can the employer be required to give the employee a phone that can use such an app and a service plan if the employee doesn't have one or the other? It seems to me that if you don't do that, you could end up in a discriminatory way against certain classes of employees. I got to add one more thing here while I've got the mic, just real quick. We have all said there needs to be focus on the particularly vulnerable communities, and I believe that firmly. We need to start thinking about what that focus looks like, what consultations are going on with affected communities about whether they'd actually use exposure notification apps, what kind of trust would have to be built. And I don't think those conversations have even started. And then we also have to recognize, though, that even if a vulnerable community, if members of a vulnerable community are not using the app, but the app is doing some good, the members of the vulnerable community can get some benefit. Example, in a nursing home, there might be 0 people who actually download the app, who are residents of the nursing home. But if their visitors have downloaded the app and the app is doing some good, and the child of one of the people in the nursing home gets a notice that they may have been exposed and thereby alters their conduct, doesn't visit for 14 days, that helps everybody in the nursing home, even though they wouldn't download the app. So I think we have to recognize that there is this broader community benefit, if you will, potential benefit if the apps actually work.
That's great, Greg. That actually connects with the next question I was going to ask, which is, how do we work on communicating, right? I think, Wendy, you even mentioned that there's been less focus on enforcement because we haven't even gotten there. And it's been more so about raising awareness and about just, asking people to follow through. A lot of messaging, wear the masks, stay 6 feet apart, make sure that you stay at home, constantly wash your hands. A lot of public health, I think in general, is just creating educational campaigns and creating awareness and educating and empowering people to take the right steps. So what are some of the lessons that we've learned from the past in how to communicate and how to educate and empower various communities on this topic? And how does that link to communicating and creating awareness and trust in these communities, right? And, Greg, I'll start with you because you just left off talking about, better working with communities, vulnerable communities and communities of color and communities that have been hit particularly hard. And I guess, my questions are always ridiculously multi-parted, so I apologize. But to what extent is communication even going to be effective if, as Wendy said, we don't necessarily have the right tools? I've read a lot about Navajo communities or, indigenous communities and tribal communities. You can tell them all you want that, they have high rates of the virus, but if they don't have access to the right healthcare, if there's no way for them to really separate or, do all sorts of other things, what are we doing? Are we, creating mass hysteria the way that social media likes to tell us that we are? So to the extent that you can answer all those different parts.
The point I was making was just that I don't think that the members of the community or the people who the communities trust have even been asked these questions yet.
Mm-hmm.
And I think that we have to go there first. Ask questions like, do you think people would use such an app? And then ask even the more basic questions. What do people need? What do they need to fight this pandemic?
Mm-hmm.
And if you're not getting answers like they are going to respond positively to receiving a notice that they may have been exposed, you need to think about focusing resources somewhere else. And I don't think that we've really grappled with those questions yet.
Mm-hmm. Woody, do you have anything to add?
No, I think Greg makes a very good point. I mean, that when you allocate, when there's a lot of hours of labor and resources that have been devoting to these contact tracing apps, and I get the need for expediency because, of course, every day matters. But one of the things that I really do worry about is that there are opportunity costs to taking particular paths, particularly thinking about leveraging technological solutions that, if they're not going to be effective, actually have foreclosed looking into other things that we are actually more confident will work. Because it seems like there's a lot of speculation, some of which is necessary, but if it's unnecessary, we've just cost a lot of intervention in other areas.
Mm-hmm. It looks like we have a question from an attendee. So Tony, shall I hand it back to you?
Sure. So in the spirit of Greg's invitation at the beginning of this session, inviting folks to turn on their camera if they feel comfortable, turn on their mic so that we could see your faces. I want to invite the person, Matthew Smith, Professor Smith, to turn on his mic or turn on his camera and pose his question. And I would encourage everyone else, if you have a question, please feel free to either tag us or to send us a message privately or let us know in the chat. Are you there? If not, I also have the question, so we can ask the question if you're experiencing any technical difficulties.
Am I audible now?
There you are. Yes.
Well, I apologize. Okay, my question was actually just in response to the earlier comment about how a public health system being truly public would actually resolve some of these problems. But I just wanted to invite people who had thought a lot more about this than I have about whether or not to let me know whether or not that would actually work out. Because the question I asked was, wouldn't a sufficient public health system still have to collect all the data? Wouldn't state coercion replace private power when it comes to requiring the applications that collect that data? Is the sole difference just the possibility of democratic oversight? But then democratic oversight, especially at national levels, is often as difficult to realize as is successful resistance to the application of private power. So I'm not, and furthermore, it seems to me that democratic oversight is oftentimes absent anyway. So I'm just wondering, I'd like to hear more about why moving data collection to the state resolves the worries that were initially raised. I understand that it may not, there are other worries that it probably resolves though. Okay, thanks a lot.
I think first we have to ask ourselves, even if there are private actors involved, does that mean that the state won't have the same level of involvement that it otherwise would? Example, if you get a notice that you were exposed to someone who has COVID-19, you could take the next step all by yourself and just self-quarantine or go get tested. And maybe you can't get tested and get results in a reasonable amount of time. That's a reality. Maybe you can't really self-quarantine. That's a reality. But you could take those steps and the state wouldn't necessarily be involved. I'm guessing, though, that a lot of people's reaction is actually going to be to contact the state, and that the app notice is going to encourage people to do that. And it makes sense. The state will want to know who you were exposed to or who didn't have the app, right? And the state would do its contact tracing by whatever means it normally does in the manual world. So I guess what I'm saying, Professor Smith, is I'm not sure that we're actually replacing the state with the private system. We might replace some aspects of what the state would normally do, but I think the state's going to be involved nonetheless. And I think the state needs to be regulated with respect to its use of data nonetheless.
Yeah, I'd agree with Greg. In fact, I think that the distinction between state and private enterprise is blurry at best, and that in any solution you're going to be dealing with probably a collaboration of state actors and private actors. But I do think it's worth drilling down a little more and saying that certainly, I mean, the question that you asked is the main difference democratic oversight and accountability, and certainly I would give a resounding yes to that, particularly when you consider the incentives of private actors in a lot of this that don't necessarily align with what might actually work with a public health regime. That they're contributing, but there's no guarantee. And certainly we've seen the sort of always on background radiation of potential for self-dealing and opportunism that comes with taking hold of the public health apparatus. And then to drill down even a little more, just because it goes to the state, of course, doesn't necessarily mean that it goes to law enforcement, that we might say public health authorities we would want them to have data. What we're really worried about is the law enforcement authorities co-opting that data, at which point I would argue that we would need strong rules preventing that sort of bleed over or that sort of mission creep in general in order to mitigate some of the harms. Because I don't think just because it goes to the state, it solves a lot of our concerns. I think that just raises a different risk profile that we would want to address, that I do think is addressable, but would need to be addressed.
Hey, Jennifer, can I ask Woody a question?
Yes, please do.
Okay, so Woody, in my state, Maryland, we're getting these TV advertisements now that say, if you get a call from the health authorities and the caller ID says COVID-19, answer it because it's a contact tracer. Now, so then they're running these ads on the local TV channels. Would you be more likely to pick up the phone when you see that COVID-19 warning and act, or would you be more likely to act if you received one of these anonymous notices from electronically on your phone that you may have been exposed to someone who has COVID-19? In which scenario are you more likely to act, or are you likely to act in both?
Well, so certainly I'm not the right person to answer that because I'm so skeptical of everything. I wouldn't answer either one because they both seem like scams. But you really bring up a critical point, which is that certainly fraud is the potential for fraudulent behavior. People will act opportunistically, even private parties, to try to scam people. The FTC has already, of course, had their massive, really interesting, informative, watch out for COVID scams part of their websites loaded up. And a lot of it is because we are sort of now, the way in which we envision sort of protecting ourselves so much in the United States is built from this like because it's built from this notice and choice perspective, this whole watch your ass, like you're the one that needs to watch out for fraud. And so I think that without sort of better education, it all seems like a scam. And I think it will probably seem like a scam to a lot of people. And then we sort of get into the gaming, and like when, you know, someone will figure out how to change one digit on the phone. So I don't know. I don't know if that was exactly responsive to your question, but I take your point that there's potential for fraud in a lot of these systems, and that it needs to be mitigated.
I just want to read an interesting comment that somebody wrote, Ellie Daw, or actually Ellie, I'm going to invite you, if you'd like to share it with the group, you're more than welcome to as well.
Sure, yeah. So I was just putting a little comment after Greg's point, but I've been working with the TCN Coalition, which is a nonprofit organization to kind of connect a bunch of groups that are building privacy preserving applications for exposure notification. And in the US, a lot of these are in kind of pilot modes. There aren't any like fully deployed yet on this private model. But all of them are so far directing people toward contacting their public health authority upon notification of a positive contact. So just kind of a note, that's where they're going to be directed when they get notified.
Ellie, can I ask a follow-up question? Is the specific contact information listed, or is it just a general warning to say contact your public health authority?
It will be listed, yeah. So working with public health authorities as well as the app developers to get everything like actually correct for each location. But yeah, it'll be listed.
Thank you.
So so first of all, thank you, Ellie. I want to just turn it back over to our panelists to ask if Woody, if you have a question for the audience or for Greg.
I do. I mean, I've got a general question that I would love people's thoughts on. And I'll start, I guess, by asking Greg, but if the audience also has thoughts on this, I would welcome it, which is a lot of what we do in privacy law and technology, you know, with the relationship between law and technology. I spent a lot of time asking whether this is a new problem or just a sort of a worse problem than what came before. Maybe so a difference in magnitude versus a difference in kind. And one of the questions I've been really trying to figure out, and Greg, you made the points sort of explicitly by saying, well, there are privacy problems with contact tracing apps, but of course, regular contact tracing isn't a privacy risk-free endeavor, which is of course true. And so one of the questions I had is, when we have this conversation, are we talking about a fundamental shift in the way in which we are hoping to collect public health relevant information from people, or is this the kind of thing where the problem that we're facing is really just one of scale, that we actually have all the solutions, we know what we're doing, we're just trying to figure out how to get this to scale properly?
I guess it's about scale and speed, right? I mean, we're in this situation where if there's, take the scenario where I realize I'm infected, and now I want to give people who I love or the people who I've had contact with some protection by giving them some notice. I know who I can call, and I'm going to call them directly. I'm going to call the health authority, and they're going to start asking me a bunch of questions. But I might also want to give notice to strangers who I really don't have a relationship with, but feel a social responsibility for. Without the apps, I can't do that. There's not a good way to do that, right? You can call the Starbucks and say, I was in there for a half hour on Tuesday. but they're not going to have a record of the customers who were there. So I think that it's kind of a combination, Woody, of scale and scope, if you will. In some ways, we are in new territory, and in some ways, we're just dealing with a long existing problem in the fight against pandemics.
Thank you, Greg. I appreciate that.
So I do have one, I guess I would call it a final question. And if you wanted the panelists or if our remaining panelists want to share some final thoughts after that, that would be great. So we've heard, over the last, during our time together in this session, that there are myriad issues here when we're thinking about not only the deployment of contact tracing, but its implications for public health. We're thinking about, who has the responsibility to manage the information and manage both the input information and what to do with the output of information. What do we do? Who do we call? Do we trust those sources? What is the potential of for fraud or taking advantage of having access to this data? This idea of, what you mentioned, de-identification and models for that could be potentially effective. Thank you, Ellie, for sharing some of the work that you're doing. And so my question ultimately is, when we think about not only policy and we think about the direction of the law and government regulation, when we think about the innovations that are being introduced by big tech as their kind of big shiny solutions, the big shiny toy to solve the problem, these really big problems that require far more than an app could ever solve. Where do we go from here? Where do we go from here? What do we do? What are some things that we could be thinking about in terms of our roles? So when I think about our audience, some of us, some of our participants are researchers, some of them are students, some of them are lawyers, some of them are policymakers, some of them are technologists. And so with all of that, thinking about all of that, where do we go from here?
I wish Wendy was still here. She kind of previewed a brave new world. The brave new world is when we're actually on the curve down and there are a limited number of people who are infected and who may infect others. And we have to grapple with the questions about how we are going to deal with those people and protect others against getting infected. Right now, the measures are minimal and they apply to everyone. And it probably should be that way when you're applying measures to everyone. What happens when there's just a relative handful of people who are of concern? What measures will we apply to keep the rest of the society safe? How will we be using technology and data to isolate or quarantine people or to enforce social distancing rules? Some countries are using very intrusive methods, and I have a lot of concern about them. And I have to admit that sometimes those countries have been effective in fighting COVID-19 with those intrusive methods. How are we as a society going to respond when we're in that situation? And it's going to sound strange, but we want to be in the situation where there are just a relative handful of infected people who have to be protected and protected against.
Thank you, Greg. Woody, I want to turn it over to you.
Sure. So that was well said, Greg. The answer, where do we go from here? I do wish Wendy were here as well, because I would echo a lot of what I think she said at the beginning, which is you can't go around this. You have to go through it. And what I mean by that is we have to have a complete revitalization and recommitment to our public health institutions and infrastructure. And the way that plays out in my sort of corner of the woods is what I've seen so far from a law and policy standpoint with respect to privacy and data protection is that we are treating contact tracing applications, and we are treating exposure notification as presenting privacy problems that need to be solved before they can be implemented, right? And we're keeping the two things completely discrete. And what I think is the much better approach is to consider our privacy and data and informational concerns as part of an overall reinvestment in public health. Because what that would mean is that we would have a much broader perspective on the things that we need to change in order to move forward. We would be then able to target the fact that platforms are enabling all kinds of disinformation around COVID-19, and we would quit sort of outsourcing the public health messaging function to these private systems, and we would try to sort of regulate that and then rein it back in. We would work on preventing mission creep overall in order to help build trust back within the digital ecosystem, and that we would create hard walls between, say, law enforcement, which doesn't have anything to do necessarily, though I realize that is not always true with the public health apparatus, but making sure that mission creep doesn't occur. And if we consider involving our informational rules as part of our recommitment to public health, I think that we will get at a lot better both public health outcomes and privacy outcomes than simply treating in an atomistic way contact tracing apps as presenting privacy problems that need to be solved by specific legislation.
So we've got a few minutes left. Thank you, Woody, for that. I feel like we've got a lot of food for thought here, and we could very easily have this conversation for at least another hour or so. But I am going to wrap it up here and offer the audience a final opportunity to ask us any questions. If you're in the Zoom, if you're in the room, we would love to have you ask that question on the mic or on video, or you can, and if you feel more comfortable sharing it in the chat, we'd also welcome and invite you to do that as well. In the meantime, I just want to share a little bit more about the series and what we have planned next. Our final event is next week on the 4th, August 4th, at the same time, noon to 1:30. We're going to explore protests, artificial intelligence, and narrative and storytelling. And so we are going to be joined by 3 panelists who are going to talk about essentially the proliferation of what the protests in solidarity for Black Lives Matter, but also what we're seeing, the kind of the rising protests that we're seeing across the country, but particularly in Portland and major cities across the country, and what that means in terms of the way that data about the individuals who are participating is being tracked, and the implications for what that means for big data and AI and automated systems. So that's the conversation we're having next week. We'll be joined by Rashida Richardson from AI Now Institute, John Wibby, who's from Northeastern University School of Law, School of Journalism, and one of our students from the, oh my goodness, my mind just went blank, from our restorative rights and community justice clinic here, and I've totally just botched that, but
civil rights and restorative justice.
Civil rights and restorative justice. There are clearly a lot of things on my mind as I'm thinking about not only the conversation, the questions, your questions, some of what's being shared, but also just particularly this moment that we're in. And so I would encourage you to join us next week and register techjustice.eventbrite.com if you'd like to join that conversation as well. But also follow our panelists. Follow our panelists online, get to know their work. We shared some of the articles related to this, related to contact tracing and COVID as part of the Eventbrite. If you clicked on to the link for this event, you'll see that there were some articles listed from this event, but also from our event last week, where we talked about racial justice and surveillance technology. So again, I want to say thank you to our panelists. I don't see any additional questions. And so I want to also thank our co-host, Jennifer, and the Center for Health Policy and Law for joining us and for co-hosting this event with us. And Greg, Nojim, thank you so much for your insights. We're going to continue to follow your work, and hopefully we can revisit this conversation and have another conversation about, you know, the kind of an assessment of what contact tracing has done in terms of changing the way that we work now that a lot of us are kind of being mandated to go back to work. And also Professor Hartzog, again, thank you again for your insights. I'm going to turn it over to Jennifer to see if you have any final words you want to share before we take off.
Thank you to all of our speakers. Thank you to Tony and CLIC. Thank you to everyone who attended, who shared their thoughts. Terrence, I saw that you shared some beautiful words of wisdom as well in the chat when I was scrolling through to see if we missed anything. This idea of watching out for one another is not always a bad thing, right? It's a good thing, and perhaps more than ever, we need to be reminded of that. And so, you know, continue to watch over you all. You know, feel free to tweet at us if you have thoughts, not only about this series, but feel free to update us with interesting things that you see or are hearing, questions you might have. Yeah, we just want to keep hearing from all of you. So please take care, stay safe, and it was lovely to see everyone today.